Now we're going to repeat the same drills but on the floor, which you'll find, perhaps surprisingly, quite a lot more difficult because now the spine is at right angles to gravity. This is what it looks like. Firstly, position yourself so you've got your weight evenly on both hands and on both knees. Then practice the back arching movement first, like so. Then, without moving any other part of the spine, tuck the tail, that's the cue that we use, and come back to neutral, and then tuck the tail even further. What we found is that when the spine is challenged in some of the later exercises, that people have two ways of basically avoiding the stress or collapsing in the movement, and the most spectacular is when this happens. So to be able to counteract that tendency with a strong tail tuck is absolutely essential for later movements. Now the second of our spinal cues, which is changing the shape of the thoracic spine, looks like this. We'll curve it first, and as you can see my upper back is strongly bent forward, then through to a more neutral shape, and then watch, by bringing the sternum along the floor in this direction here, we can achieve a flattening of the spine. And the key thing about the flattening of the thoracic spine is it brings the ribs away from the pubic bone. And as we'll see in later exercises, when this space is increased between the ribs and the pubic bone, some key muscles have to fire. The majority of people, when they're stabilizing the pelvis or working against gravity in a position like this, actually use the superficial layer of abdominal muscles, and we'll go into that in more detail. The key thing at the moment is to be able to practice this movement and separate it from this movement, and then last of all to try and bring the chin in to try and flatten the cervical curve to some extent. So altogether the movements look like this: tuck, flex, neutral, sternum along the floor, sternum towards the pubic bone, sternum along the floor towards the chin to flatten the thoracic spine, and last of all to bring the chin in slightly to further flatten the cervical spine. Now I'm going to ask David to come in with a stick, and he's going to show you with the aid of the stick what those movements look like in detail. I'm in the same position now, but David will lay a stick gently, you better make it gentle, along my back like this, and this way, once the stick's in position, I can feel where my head needs to be, and I can also feel that the stick is resting on the sacrum, on my upper middle back, and also on the back of my head. Now watch this. David puts his hand in between the stick and my lumbar spine, and straight away I can feel when the spine is neutral, or what we call neutral, with a small amount of lumbar curvature. And if he takes his hand away, watch this, now we can actually flatten the back completely. And in some exercises we will want that kind of control. So let's just let the back go back to this sort of position. And now if you look at the space between the stick and the back of my neck, just watch this. If David puts his hand in between the stick and the back of my neck, we can practice reducing that space like this simply by elongating the spine until there's about a hand spacing or so left there. If I slump, you'll see straight away how much that increases that curves. So back to here, reasonably straight, and in this part of this drill, I'm actually trying to make my spine as long as possible. And this will surprise most of you, but even in that position there, when the spine is flattened as much as possible, I can already feel these lower abdominal muscles starting to contract. So that's the exercise. Grab a partner with a stick and make sure that you can change the shape of all parts of your spine when on your hands and your knees.